The dietetics of chronic renal failure in dogs and cats. So chronic renal disease, chronic renal failure, and chronic renal insufficiency refer to the same disease. There is different causes. You can have congenital malformation, hypertension, and pyelonephritis. There's no signs until 75% of the nephrons are damaged and from polyuria and polydipsia and increased creatinine. The clinical signs are vomit, weight loss, polyuria, polydipsia, incontinence at night, anemia, and secondary renal hyperparathyroidism. They modify the osteoclasts that take calcium from the bones, and they deposit the calcium and phosphorus in the soft tissues. So diagnostics. You can have non-regenerative anemia, increased phosphorus, increased blood urea nitrogen and creatinine, and dilute urine. The pathophysiology. They have a decreased ability to excrete nitrogen waste, such as urea and creatinine, decreased ability to excrete phosphorus, and declining kidney function, decreased production of cholesterol, which is vitamin D, and a decreased ability to degrade PTH. The treatment, reduce the workload on kidneys and replace the deficient substances such as potassium. Fluid therapy and dialysis to reduce the waste products. So you need to maintain the acid-base balance and the water electrolyte balance. And it's very important to decrease the protein. You can't reduce all the protein, but you have to keep it in the reference range and keep it as low as possible. Ensure high digestible protein so the waste nitrogen products don't reach the kidney. Have a high biological value, and amino acids from plants are not the same as amino acids from animal. So animal origin is better biological value and digestibility. And make sure you give them food low in phosphorus, so eggs, soy, whey powder, and skim milk. And do not feed meat. It has good biological value, but it's too high in phosphorus. And make sure the protein is around 12% for a dog and 20% for a cat. Cats require more protein, and the metabolizable energy is 17 mg per kilogram. And the water. Encourage flavor water with low sodium. And do not give dry food, and give EPO to prevent anemia. Potassium. Give hypokalemia because of the loss of potassium and the decrease of appetite. And hypokalemia causes muscle weakness and painful. So you treat with potassium gluconate or citrate, which is given orally. And phosphorus and calcium. So phosphorus, the kidney diets alone, phosphorus and calcium. Phosphorus absorbents such as are supplemented, such as intestinal AlCO3. And calcium and vitamin D supplements are avoided until the phosphorus levels are under control. And acidosis and sodium. So the first one, phosphorus increases, vitamin D decreases, calcium decreases, and PTH increases. So severe CDK causes metabolic acidosis, and the renal diets are to counteract the acidosis, and calcium carbonate and potassium citrate. The diseased kidneys are poor at regulating sodium, so excess sodium and water retention. Fats and lipids. So chronic renal failure are prone to hyperlipidemia because there's less protein to provide energy. Fats, such as polyunsaturated fats, have many omega-3s and may slow down the decline of kidney function. And fiber. Use fermentable fiber that alters the flux of urea and NH3 in the cecum. Shift urea excretion from the kidneys to the LI, and the diet change gradually over 1 to 2 weeks. Glomerulonephritis, so nephrons are inflamed but not dead. This causes persistent proteinuria, such as hypoalbuminemia, which decreases the oncotic pressure and causes ascites, which increases the blood pressure. Ascites is edema in the hydrothorax. And treat with low protein, high biological value, and low sodium. Decrease the hypertension and maintain the blood urea level at 3 to 5 millimoles per litre.